Hey guys, Professor Juan. This is your lecture on blood vessels, lower limb. To start, we have to go inside the pelvis, inside the abdominal cavity, to kind of know how the blood vessels get out of the pelvis into the lower limb. Because that's where all the blood vessels are connected to the heart. They're in the abdominal cavity coming off the heart. Basically, we'll start here with the abdominal aorta. Okay, that's what we see here. The abdominal aorta ends right there and bifurcates at about the level of L4 into the common iliac arteries. So, first thing to note, abdominal aorta. Abdominal aorta, it runs from about the level of T12 to L4 vertebra. Runs from T12 to L4 vertebra and ends by bifurcating into right and left common iliac arteries. Terminates by bifurcating into right and left common iliac arteries. So I'll just give you a second to copy that down if you're taking notes. Let's look at this picture here. It's basically the same picture. It's just an illustration. I have some things colored there. Let me clear the board here. So we ended by saying we have the common iliac arteries. I have the right common iliac artery highlighted in green. It bifurcates into internal and external iliac arteries. Common iliac arteries bifurcate into the internal and external iliac arteries. Now my picture, the external iliac artery is yellow, and this bluish color is the internal iliac arteries. And so what we can think about is from the abdominal cavity, there are blood vessels that enter the pelvis, okay? And so let's think about that. Some blood vessels enter the pelvis, they supply blood to the pelvic viscera, but some of those blood vessels will exit the pelvis to supply blood to the lower limb. So let's talk about the blood vessels that simply enter the pelvis. Two, we just mentioned. Two blood vessels that enter the pelvis, specifically arteries, are the right and left internal iliac arteries. That's two. Arteries that enter the pelvis. Okay, we have two internal iliac arteries. That's the right and the left. You also have this artery right here. that's actually the inferior mesenteric artery, but it continues on in the pelvis as the superior rectal artery. Okay, so that's another one. You have one superior rectal artery that enters the pelvis. You also have this one right down middle of the sacrum called median sacral artery. That enters the pelvis. Median sacral artery. So let's take a count. We got 2, 3, 4. And that will be the case for males and females. However, females also have the gonadal arteries that enter the pelvis that supply blood to the ovaries. So only in females you have 2 gonadal arteries. So that would be 6. But that's only in females. In males, let's remember the gonads are the testes, and the testicular artery never enters the pelvis. It exits through the inguinal canal and goes into the scrotum, never entering the pelvis. So basically, you have 4 arteries that enter the pelvis for males, but 6 for females. Next slide. Look at the blue arrow here. What I want you to notice, that blue arrow is pointing to a landmark. The landmark is the ureter, which transfers urine from kidney to bladder. That ureter always seems to cross the iliac arteries just distal to the bifurcation. So that's a useful landmark to look for. Let me write that down. The ureters cross over the iliac vessels just distal to their bifurcation. Just distal to the bifurcation of internal and external iliac arteries. So here's the ureter, blue arrow, then there's the external, there's the internal. There's the blue arrow, it's my landmark, ureter. There's the external, and the internal is kind of out of sight on that picture. All right, moving on. We're going to talk about a couple of ligaments of the pelvis that create these holes in the back called sciatic foramina. Because remember, we kind of have to talk about how arteries exit the pelvis to supply blood to the lower limb, specifically the gluteal region, which we'll get to. I have some colors set here. The ligaments I want you to know, the one I kind of traced over in yellow here is the sacrotuberous ligament. This little one behind it, I scribbled in blue, is the sacrospinous ligament. Those are useful landmarks for us. I'll write those down as 2 ligaments you should be able to identify. Sacrotuberous ligament. Sacrospinous ligament. These ligaments create what are called the greater sciatic foramen and the lesser sciatic foramen. So the sciatic foramina, to be short, create the sciatic foramina. So these foramina are spaces in the gluteal region. It's how things kind of exit the pelvis posteriorly. Here's a picture that can help us understand that concept. This is the posterior view of the ligaments we're just talking about. Here's a lateral view where we can see these spaces. You have greater and lesser sciatic foramina. Okay. So these sciatic foramina, no, there's a greater sciatic foramina and a lesser sciatic foramina. And in the picture that we're looking at, the yellow space is the greater sciatic foramina, and the little blue space is the lesser. Okay, if that's projecting too well, this big space here is the greater. We'll talk about that one mostly. This little one here is the lesser. So notice that this big muscle coming out the greater sciatic foramen, that's piriformis. You want to write that down as a landmark. So for the greater sciatic foramina, piriformis exits. That's kind of a landmark muscle for us in the gluteal region, and so we'll refer to that later. Let's continue on here. There's kind of a blank picture showing you the greater sciatic foramina. That piriformis is a landmark. Here's an internal view, a sketch view of the pelvis. We're going to study the branches of the internal iliac artery. So, follow it back up to the abdominal aorta, common iliac, internal iliac, external iliac. We'll go back to the external iliac later. Here's the internal iliac. There are two major divisions of the internal iliac artery, anterior and posterior divisions. The internal iliac artery has two major divisions, anterior, posterior divisions. So I'll just write has anterior and posterior divisions. And those major divisions have branches, but just note the divisions for now. All right, let's follow the anterior division right here. There's a bunch of branches here, and I'll just go over the ones that I would like you to know for your exams. Anterior division only. Now that first branch coming off, it's number 4 there. That's the umbilical artery. So my numbers refer to the numbers on this figure here. Number 4, umbilical artery. Next branch coming off, it exits, goes to the medial region here. It's going to exit through the obturator canal. It's the obturator artery. It's going to supply blood to medial thigh muscles. It's number 5. This little branch here, it's got cut off. You can't see where it's going. It's number 7 here. That's middle rectal artery. Number 8, right here. It's pudendal artery. It supplies blood to the external genitalia. Internal pudendal artery. Now there's a branch coming off, it got cut off, there's no number to it, but that branch you gotta know. The branch of internal pudendal, I would like you to know, is the inferior rectal artery. So, no, sorry, there's no number to it. I'll just list it under here as the inferior rectal artery, a branch of the internal pudendal. The last branch, number 9. This branch right there, it's exiting inferior to the piriformis. It's the inferior gluteal artery, number 9. Inferior gluteal artery. So let's talk about the posterior division. Posterior division, there's one branch you got to know. Well, there's more than one branch, but the one you have to know right here is labeled number 2 there. That is the superior rectal artery. Labeled number 2 on this figure. One branch you gotta know. We're gonna move away from this figure. Here's some blank figures. You can quiz yourself later. Another blank figure. Here's a model we have in the classroom. You can study that. Here's another model we have in the classroom. Now, one thing to warn you about when studying the models, we have keys, so you can kind of like go over them yourself. But know that there are some variations in the pelvic arteries. They're highly variable in cadavers, and it's even shown in our models. I have this keyed out for you, you can look at it. For example, this one shows superior, inferior gluteal arteries, both branching out posterior, but I didn't teach it that way. One comes off anterior, one comes off posterior, so there is some variation. You just have to go with the keys that we have in the room when you study this in the lab time. I do want to talk about the superior and inferior gluteal arteries using this picture. If you look at this picture and you dissect deeper, you can see the superior, inferior gluteal arteries exiting the pelvis. And they squeeze out of there above and below the piriformis. Okay. If you kind of look in your atlas, they kind of call this the suprapiriform, infrapiriform regions. So think of it this way. Here's piriformis right there. Let me kind of color it in. Zoom in on this one. Kind of pear-shaped muscle colored in green. And one way I want you to see, there's things exiting inferior and superior to it. So very simply, using piriformis as the landmark, you have a superior gluteal nerve, artery, and vein exiting above it. Okay, and then an inferior gluteal nerve, artery, and vein exiting inferior to it. All right. So let's note that. Call this gluteal region. So sometimes they call this nerve, artery, and vein together a bundle. So if you see that term, that's what it means, just the nerve, artery, and vein all together. You have superior gluteal, NAV, nerve, artery, and vein bundle, exits superior to the piriformis, the green muscle. Likewise, inferior gluteal nerve artery vein bundle exits inferior to the piriformis. Just write it all out for you. Inferior gluteal nerve artery vein bundle exits inferior to piriformis. Shown there and there. There's the superior, there's the inferior bundle. Pull back a little bit. This deeper dissection shows the superior bundle there, inferior bundle there. Okay? Something you should know in terms of blood supply. It's really the inferior bundle that supply gluteus maximus, which has been cut here. The other two glute muscles, medius and deep ptuit minimus, supply blood and innervation to those muscles. It's the superior bundle that does that. So to clarify, got these notes here. So this bundle, I'll erase this sentence here. I'll say supplies gluteus medius, gluteus minimus. Gluteus medius and minimus. Okay, those muscles. The inferior bundle supplies gluteus maximus. Continue on. Here's a model got in the room. One thing that's obvious I didn't say in the previous slide, but you should be able to identify this nerve, biggest nerve of the body, also exiting inferior to piriformis, the sciatic nerve. Okay, so we're going to add sciatic nerve to your notes. I do it. There's the inferior gluteal artery, superior gluteal artery. Notice that they're not showing the entire bundle, the vein and the nerve too, but it's just the artery on that model. So that's kind of how blood vessels kind of squeeze out the back to supply blood to the gluteal region. I want to kind of take a bit of a sidetrack and now to talk about fetal circulation. I kind of put it in here after you've had some heart and some blood vessels so you can kind of appreciate how it works better. And we'll get back to the blood vessels of the lower limb in just a second. But to talk about fetal circulation, I introduce it here because I just taught the umbilical arteries and how they branch off the internal iliac artery. They're shown here. Okay. So to talk about fetal circulation up here, there's one thing I'd like to highlight. Now what you're looking at here is adult circulation contrasted with fetal circulation. Let's look at this here. What we usually talk about in this class are the bypasses, how it's different fetal versus adult. One big difference is you can largely bypass blood flow to the lungs. You can kind of almost eliminate the pulmonary circulation because babies in a water-filled environment, they're not breathing. In fact, the lungs are filled with air. I'm sorry, the lungs are filled with fluid, not air. Okay. All right. So, fetal circulation. Because baby's lungs are filled with fluid, that provides more resistance to blood flow, which kind of eliminates the pulmonary circulation. Pretty much, think of it this way. Blood will flow down the path of least resistance. If the lungs are filled with fluid, that provides a lot of resistance, and it changes how blood flows to the heart. Okay? So, this first bypass, we call them, we have 2 lung bypasses if we want you to know. No, 2 lungs bypasses. Basically, blood will get from right heart to left heart without going through the lungs. One of those ways it does it, it goes right to the right atrium to the left atrium, therefore bypassing the lungs. We have blood flow from RA to LA, therefore that's a lungs bypass. Now, kind of the hole it goes through, when it's open, it's called foramen ovale. When it's open, it's patent. Okay? So, to go from RA to LA, it's through foramen ovale. Patent on that figure means open. That's one way one thing I want you to know. In adult circulation, it closes. It's like a little flap and it closes. When it's closed, I mean, you still can call it foramen ovale. I see a lot of models call that little depression in the interatrial septum called the fossa ovalis when it's closed in adult circulation, and it's actually easier to flow to the lungs instead of flowing to the other side. So this is adult circulation. Baby takes first breath, lungs fill with air, air provides much less resistance, blood flow gets to the right atrium, it says, okay, there's less resistance to actually go to the lungs now, and you won't go through that bypass anymore. So what I would note is it's called, put a line here, it's foramen ovale when it's open, it's fossa ovalis when it's closed. Fossa ovalis in the adult when it's closed. It's one bypass. Another bypass, using the same figure, is the ductus arteriosus. Still a lungs bypass. In this bypass, you're going to go straight from the pulmonary trunk to the aortic arch through what's called the ductus arteriosus. So you go straight from pulmonary trunk, you go right to aorta through ductus arteriosus. You guys ID'd it on your sheet parts. The other lungs bypass, okay? Again, when baby takes first breath, lungs fill with air, and that changes the resistance, so that blood will preferentially flow to the lungs and not the aorta, and this closes. When it closes, they say it's obliterated, it becomes a good ligament. Basically, unused blood vessels make great ligaments when blood isn't flowing through them. You just call it ligamentum arteriosum when it closes up. So that ductus arteriosus is called ligamentum arteriosus when it's closed. Okay, one more bypass. This is a bypass of the liver, not being used very much because mom is digesting the things for baby, the nutrients, and they can just cross the placenta. So baby doesn't need liver too much. It's kind of highlighted here. Can't really see it. So I can trace it over it in some kind of blue color. I'm tracing in the figure where they have it there in adult circulation there. So maybe you can view it better in this video. So the last one we learned one liver bypass. You go straight from umbilical vein to inferior vena cava through this ductus venosus. Again, go straight from your one umbilical vein, go straight to the inferior vena cava, IVC, through ductus venosus. Bypasses the liver. Closes up in adult circulation and becomes ligamentum venosum. So it's called that when it's closed. Ductus venosus when it's open, ligamentum venosum when it's closed. Some blank figures you can study. Here's a picture of the rectum, just showing blood supply in your atlas. It's this picture here. You have superior, you have middle, you have inferior rectal arteries. And one of the questions in the lecture exam study guide, I'll try to help you answer it now, is, what are these three rectal arteries, what do they branch off of? Let me go over that. Rectal arteries. The first one, the superior rectal artery, is a continuation of the inferior mesenteric. Superior rectal artery is a continuation of the inferior mesenteric artery. On the figure, there's inferior mesenteric. It's going to give off branches that supply blood to the distal colon. We'll get to that later. Continues on. Here are superior rectal arteries. Okay. Next one. The middle rectal artery, as we had discussed before, is a branch of the internal iliac artery, the anterior division. Middle rectal artery, a branch of internal iliac artery. A branch of internal iliac artery, anterior division. There it is, right there, branching off the anterior division. Inferior rectal artery, remember that was a branch of pudendal. Okay, so that's the last thing I'll note on this figure, the inferior rectal. Inferior rectal artery, branch of pudendal artery. And we'll move on from the rectum. So this picture is good for the rectal arteries, got all three of them. Let's see what happened to my picture. And this is a good time for a break. I'll figure out what went wrong with my picture.